It is my great honor to welcome Dr. John Hughes, Associate Professor in Integrated Medicine at the University of West London and Head of Research at the Royal London Hospital for Integrated Medicine, internationally recognized for his work on chronic illness and integrated medicine. Please welcome.
No problem. Morning, everyone. Dobra rana. I'm John Hughes. Like just introduced, I'm Head of Research. That's the Royal London Hospital for Integrated Medicine. On the right-hand side of the screen for yourselves, that's the largest public sector provider of integrated medicine within the UK. And I head up the hospital's research department there, which is the largest research centre for research into TCIM, traditional complementary integrative medicine, within the UK as well. Currently, we've got just over 30 research projects going on at the hospital. Oops. That includes, we've got just shy of 10 PhD students with us at the moment, and 4 or 5 medical, healthcare professionals doing their research with us as well. So that's medics, clinical psychologists, child psychologists, and so on. We have a broad range of research at the hospital, although what we do is specialise and focus on those interventions that are either already within the UK's National Institute for Health and Care Excellence, the NICE guidelines. So that's things like acupuncture, Tai Chi, yoga, manual medicine, as well as psychological therapies such as mindfulness, hypnosis, and CBT. Or those interventions with a realistic possibility of being included within the NICE guidelines. But the focus of the talk today I'll be giving is specifically around acupuncture, acupressure, and the research that we've been doing within oncology. So I'll be covering the practice of acupuncture within UK oncology briefly. I'll look at traditional Chinese medicine or traditional theoretical frameworks for diagnosing patients with cancer, and then look at some of the research that we've conducted at the hospital around acupuncture, acupressure for cancer. Okay, so currently I mentioned the NICE guidelines before. At the moment in the UK, NICE guidelines, acupuncture is included in the NICE guidelines for 5 symptom stroke conditions. It's in there for tension-type headache, migraines, chronic primary pain conditions such as fibromyalgia, complex regional pain syndrome, and so on. It's recently got introduced as well for hiccups and for prostatitis symptoms as well. So at the moment, if somebody's a UK NHS patient, they should be able to access on the NHS acupuncture specifically for those conditions. In addition to that, some NHS centres in the UK, and in particular oncology hospitals, also provide acupuncture. It's quite common for cancer centres in the UK to have an acupuncturist who is delivering acupuncture to the cancer patients for the alleviation of the cancer symptoms and the side effects of their conventional treatment. Now, looking at traditional diagnoses within acupuncture. I'm sure a lot of you will be familiar with the idea of Qi and the meridian system. So there's many forms of traditional theoretical frameworks for diagnosing within acupuncture and acupressure. Within Europe, some of the main theoretical frameworks would include traditional Chinese medicine, 5-element theory, stem and branches, and the Japanese meridian theory. In each of those theoretical frameworks, there's a focus really on the individual and the individuals presenting symptoms, and treatments can vary quite significant between different individuals, even with the same conventional medical diagnosis. I've put in bold there at the bottom that although practitioners, that this is a theoretical framework, and although practitioners are diagnosing based on this theoretical framework, currently there is no scientific research that has confirmed either the existence of qi or the meridian system. These are theoretical frameworks that the practitioners are working with. Now, the previous colleague was mentioning about the work that the WHO does. I'm also the head of the hospital's WHO collaborating centre, and I work with the WHO in a number of ways within traditional, complementary and integrative medicine, and in particular with the work they're doing on traditional medicine ICD codes. So a few years ago now, the WHO developed traditional medicine ICD codes specifically for traditional theoretical frameworks according to that originated in China but's now spread around the world. And basically what the WHO did was combined TCM with the traditional theoretical framework for diagnosis within Japan and within the Republic of Korea. And I was involved in assessing the relevance of those traditional medicine ICD codes within Europe specifically. So we asked acupuncturists across all European countries around their views on those draft traditional medicine ICD codes. And that resulted in some changes to the WHO's ICD codes. Just in brief, the European practitioners that did participate in it perceived those ICD codes to be valuable, conceptually accurate, and to incorporate the range of diagnoses utilised within clinical practice. Now, we're continuing to do work with the WHO regarding these traditional medicine ICD codes. And in particular, the WHO are interested in understanding what the dual correlation between dual diagnosis is. So how a traditional Chinese medicine diagnosis correlates with a conventional Western diagnosis, and what, if anything, is the clinical benefit to patients from receiving those dual diagnoses. We've also recently set up a minimum data set, which all WHO member states are being encouraged to collect data around. And these relate to the traditional medicine ICD codes. And this includes data on patients' demographics, age, gender, their conventional medical diagnoses, as well as what treatment they've received. There isn't a global collection of outcome measure from these consultations. However, individual member states are being encouraged to collect some outcome measure data as well. And certainly that's what we'll be doing within the UK. Now, moving on to the effectiveness of acupuncture, acupressure within cancer. There's been a lot of research conducted now on acupuncture, acupressure within cancer. And that research has largely shown that TCM interventions are effective, well, acupuncture is effective for a variety of symptoms associated with cancer and its conventional treatment. So things like pain, nausea and vomiting, xerostomia, dry mouth, as well as things like anxiety, peripheral neuropathy. Now, I'll just briefly give you a bit of a whistle-stop tour of some of the research that we've conducted ourselves on this topic. So the first one, I know that the text is a little smaller to read, but the first one was a large randomized controlled trial of acupressure wristbands versus sham wristbands versus no treatment. It was funded by the NIHR in the UK at a cost of over £500,000. We had over 500 participants in the study, and what we actually found was that there was... So patients reported benefits from using either the real wristbands or the sham wristbands. If the participants in either of those two arms benefited compared to those with no treatment. However, quantitative outcome measures, we did not detect any real difference between those with the real acupressure wristbands and those with the sham acupressure wristbands. Now, largely you would generally conclude, well, your real wristbands are no better than a placebo. And that may well be the case. However, there are some extenuating circumstances here. We had a ceiling effect, basically. The conventional chemotherapy, it was looking at nausea specifically. And the antiemetics that are used now within the UK are very effective. All of the participants were receiving these antiemetics. We didn't see that much nausea across any of the three groups. We conducted qualitative interviews with the participants as well, and we know that a number of the participants were not using the wristbands accurately. So a number of people who got the sham wristbands were manually applying pressure to the acupuncture point, pericardium 6. So there's a couple of possible explanations, but yeah. Second one is a small pilot feasibility trial looking at auricular therapy, where you attach the semen vicari seed to auricular points versus self-administered self-acupressure versus no treatment. And this is looking specifically at insomnia within cancer patients. A lot of cancer patients post-treatment are still left with the symptom of insomnia. So we were seeing whether we could give them a self-management technique that would improve that insomnia for them. We used the PSQI insomnia scale to assess the impact of treatment. Those in either of the two active treatment arms were asked to manually apply their treatments on an evening, an hour before retiring to bed. And I'm pleased to say that with this one, both of those interventions appeared to be effective. Both were clinically effective for the patients that were receiving those interventions. However, the caveat with that is that this is a small pilot feasibility trial. Those findings would need to be confirmed in a large phase 3 randomized controlled trial, which at the moment we haven't took that one forward yet. More recently, we also did a large randomized controlled trial. Again, this one is about £500,000. This one was specifically actually looking at whether we could train radiotherapists to deliver acupuncture to cancer patients. It was a large feasibility trial, so we were assessing aspects of the research design as well. The focus, the primary objective, is not to ascertain whether the acupuncture was beneficial for the patients. The primary objective in a feasibility trial is to assess whether your methodological design is fit for purpose and whether that needs to be amended, tweaked in any way before taking it to a phase 3 definitive trial. Again, within this one, we found that the methodological design was fine. It's perfectly acceptable to treat the radiotherapist to deliver the intervention. All of that aspect worked well. the outcome measures and everything with the trial, that seemed to be fine. And the participants in the qualitative component of that trial, again, reported that they felt that it was valuable for them to be able to receive that treatment within the NHS, and they reported benefits for them clinically as well. However, a bit like the earlier one, we didn't find any statistically significant difference between those receiving the acupuncture versus those receiving standard care. Moving on to the slightly contentious issue of self-acupuncture. We've got a program of research going on at the hospital around whether we can teach patients how to administer acupuncture to themselves, to convert what is a safe and effective intervention into a safe and effective self-management intervention. So we've got a number of studies going on at the moment around self-acupuncture. It's actually been taught to patients at the hospital since the 1970s. Despite its long use clinically, there is very limited research out there around how safe or effective self-acupuncture is for patients. So we're trying to address that evidence gap at the moment. We've just completed a feasibility trial of self-acupuncture for chemotherapy cancer patients. We're currently crunching the numbers to see how effective or not that intervention was. The aim was to recruit 80 participants. We didn't hit our target population. Those who got randomized to self-acupuncture had an hour and a half dedicated session with an experienced acupuncturist who taught them how to insert a limited number of acupuncture needles safely into their own body, the points being on the leg, and the participants were asked to insert these needles a couple of times a week. We're still crunching the numbers, however, it does appear as though self-acupuncture is certainly acceptable to the participants, and certainly from the qualitative data that we've already analysed, the participants who were randomised to be taught self-acupuncture, they certainly perceived it as being acceptable. They were able to do the self-acupuncture and they perceive it to have had beneficial effects in terms of their cancer symptoms and the side effects of the conventional treatment. We've got other studies that are just starting within acupuncture and cancer. One of a PhD student that's just starting with me now, they're looking at auricular acupuncture for cancer pain, and we're about to submit a large research grant for a phase 3 definitive trial of acupuncture for peripheral neuropathy in cancer patients as well. So this is an area that we're continuing to work in. In brief, though, as a summary, the UK's NICE guidelines do not currently recommend acupuncture for oncology, though many NHS cancer hospitals will provide that treatment. There is strong evidence for acupuncture in particular, and to a lesser degree, acupressure, being able to provide an effective intervention for the side effects of the conventional treatment of cancer. So things like pain, nausea and vomiting, xerostomia, and so on. And we're continuing to conduct research to explore whether those effects can be seen if we teach the patients to do the acupuncture themselves. Thank you.
Thank you, Dr. Hughes, for your insightful presentation.